Today's video, I'm going to be taking a deep dive into boron and its effects mainly on testosterone, what the optimal dose is, and what side effects and what formulation is best for boron supplementation. Now, I have made similar videos on this topic before, but there were two separate videos. One was on the optimal dose of boron and another was on its effects on testosterone and osteoarthritis and things like that. So in today's video, we're going to combine all that information into one cohesive video and take a more deep dive into the studies so we can get a better idea of what the results are saying. Now, with that being said, let's get started on this video. So the first thing we have here are the studies that I've referenced. So here's 5 main studies that I'm going over in this presentation. You can copy paste those and follow along with the exact study if you please, but I have obviously a little snippet of each study in each slide so we can see exactly what I'm talking about. So here are the topics of discussion that I'm going to go over. So we have mechanism, its effects on testosterone, foods containing boron, different forms of boron, the optimal dosage and what dosages are used for testosterone or osteoarthritis or some other indication, and then the side effects of boron supplementation as well at the end. So again, the first thing we're going to go over is mechanism, and over here we have a little figure showing testosterone being converted into estradiol, and the enzyme that's responsible for that is this one right here, aromatase. This is what converts testosterone to estradiol, which is how you make estrogen. So what we see happening here is this methyl group gets chopped off, another double bond is forming here, and then this double bond OH becomes an alcohol. That's probably a little too advanced for most of the viewers, but for our biochem or OChem majors or people that are interested in the chemistry, just wanted to go over that little figure as a little reminder. On the right side of the figure here, we see testosterone and what it is bound to and which ones are bioavailable testosterone. And what that means is these testosterones are able to have a function on the body. They are not bound to something preventing it from having an effect on the body. So testosterone on its own, when you get a blood test, total testosterone is usually what they measure, but that's not really a great indication on if that testosterone is bioavailable and it can provide its function and give you the effects that you want. You mostly care about how much sex hormone binding globulin you have. You want that to be lower, and how much free testosterone you have. You want that to be higher. Free testosterone is testosterone that is able to have a function on you, so it's able to have a positive effect on your body. And sex hormone binding globulin testosterone that is attached to that protein is not able to have the effect that you want. So we want more free testosterone, less testosterone that is bound to something like sex hormone binding globulin. And also albumin, as we can see here, it's mildly active. It's not, it's still bound to a protein, so we're not getting the full effect from a free testosterone like we would on this left one over here. Now, only 1 to 2% of your total testosterone is normally going to be free testosterone. That is a normal amount. That's what we want. In terms of the one that's bound to albumin, it's 20 to 40%, and the majority of testosterone is bound to sex hormone binding globulin, 60 to 80%, and it is an inactive form of testosterone. So we want to make sure that our sex hormone binding globulin levels are low and our free testosterone levels are high, irrespective of what our total testosterone levels is. We want that to be higher as well. We don't want that to be low, because obviously the lower total testosterone is, the majority of that is going to be bound to a protein like sex hormone binding globulin. So you're going to have a low amount of free testosterone. So a low amount of total testosterone does indicate low testosterone levels for sure. It's not going to be something that, you have a high free testosterone amount with low testosterone total. That's not really going to be the case. But it can happen that you have high total testosterone and low free testosterone, because most of it is just bound to a protein. So that is something that we want to keep in mind. High testosterone levels may not necessarily indicate good testosterone levels in the body or optimal testosterone levels in the body. We have to look at all 3 of these together, including albumin, to see how much of it is bioavailable. Here's another figure here, just going over the same information. We see sex hormone binding globulin is increased. That means less free testosterone and more bound testosterone. So that's going to be, basically less bioavailable testosterone, and your testosterone symptoms will probably appear because you don't have optimal levels. Now, that was a background on testosterone, and from now on we're going to go over boron. It's an essential mineral and is actually essential for the formation of specific steroid hormones. Some benefits of boron include growth and maintenance of bone, improved wound healing, estrogen, testosterone, and vitamin D production, boosts magnesium absorption, reduces levels of inflammatory biomarkers like high sensitivity CRP and TNF alpha. That's where it gets its osteoarthritis effects. raised levels of antioxidant enzymes, protects against pesticide-induced oxidative stress and heavy metal toxicity, improves brain electrical activity, cognitive performance, and short-term memory in elders. Now, majority of these benefits that has been stated here, they are not very conclusive. The evidence is not great. There are some studies that show benefit, so we're not going to really go over those. They're very, left and right. They're not really that conclusive. But in terms of its testosterone levels, we have good data. So that's what I'm going to kind of focus on in this video. All right, so as promised, let's go over boron and testosterone. So the first study here is the effect of dietary boron and mineral estrogen and testosterone metabolism in postmenopausal women. So this study contained 12 menopausal women. The study lasted 28 days, and the dose of boron that was used is 3 milligrams per day. Now, the majority of viewers that are watching this video are probably going to be men that want to optimize their testosterone levels. So you're probably wondering, why would I care about a study on women? The point is that this was the first study that kind of showed that boron has positive effects on testosterone levels. If it did it in women, it could probably do it in men. We obviously don't want to extrapolate that data and say that just because it worked on women, it's going to work on men. But I want to go over it because it shows that testosterone levels do increase in women. So we can kind of try to see if it does the same thing in men. Again, the dose used was 3 milligrams per day. So here's table 1. We see dietary treatment, milligrams per day of boron. So they got a low dose of 0.25 milligrams per day, which is basically just from food, nothing really crazy. And then we got a 3 milligram supplementation on top of the 0.25 that people got from food. So that's a total of 3.25 milligrams of boron. I'm looking at this part of the graph over here. And this right column here is just aluminum. They either supplemented with aluminum or did not supplement with aluminum, and both groups did it as well. So one group, that was low dose boron, got aluminum, low dose boron, high aluminum, high dose boron, no aluminum, high dose boron with aluminum. Here's a low, and then we kind of compared it to two groups that had either a low magnesium diet compared to a adequate magnesium diet. And if you remember before from this study here, we see that boron boosts magnesium absorption. So that's basically why they care about that magnesium levels in this study. But again, our focus is on boron. So as we can see here, boron supplementation decreases urinary excretion of calcium, magnesium, and phosphorus in both the low magnesium diet and adequate magnesium diet groups. So basically, it doesn't matter how much magnesium you're getting in your diet. Supplementing with boron will increase the magnesium levels in your body because it's going to reduce the amount that's excreted in the urine. Same thing with calcium and phosphorus. That's kind of what this table is going over here. So again, these first three here show that calcium, magnesium, and phosphorus levels increase because boron reduced the urinary excretion of those minerals. And then over here, we see that estradiol levels and testosterone levels both increased in the high boron group. So when we see the high boron group levels compared to the low boron group levels for, let's say, testosterone over here, we see that basically all the levels doubled. So it went from 0.34, 0.31, 0.33, 0.3. They basically more than doubled when we take 3 milligrams of boron up to 0.71 and 0.64. Same thing with estradiol. We see that levels basically doubled, almost tripled in this case. So estradiol levels almost tripled, testosterone levels almost doubled. And this is the main basis for the rest of the studies that look into boron and its supplementation to increase testosterone levels. So let's kind of go over those other studies now. Second study here is this one, comparative effects of daily and weekly boron supplementation on plasma steroid hormones and pro-inflammatory cytokines. So the study method, now in this one, we have 8 male participants. The study only lasted 7 days, so very, very short. But the dose of boron used was 10 milligrams a day, and it was taken with breakfast. So the main thing we want to focus our attention on here is this left column in terms of what is being tested, and this right column, which is the p-value. We want to look for p-values less than 0.05 because that tells us that it will be clinically significant. There is an effect of boron on those levels. Now, this is only after 1 day, so very, very short, retesting period. But we can see that there is no change in total testosterone as the p-value is greater than 0.05. Same thing with free testosterone, no change there. No change in dihydrotestosterone, no change in estradiol. There was a change in sex hormone binding globulin. It decreased. It went from 32.2 to 29.7 because, again, the p-value less than 0.05. So we did decrease sex hormone binding globulin, which probably means we either increased the amount that was bound to albumin or we increased the amount of free testosterone. Now, although it's not clinically significant here, it still has an increase, right? It's 9.42 to 9.58. That could be due to chance, but because the sex hormone binding globulin levels were clinically significant and they decreased, we can assume that the testosterone that's bound to albumin increased, which is mildly active, so there is some more bioavailable testosterone, and the free testosterone levels also might have increased, so again, more bioavailable testosterone. So this is good news here that sex hormone binding globulin, even after 1 day, was reduced. Cortisol levels, no clinically significant effect. Same thing with luteinizing hormone, same thing with vitamin D. However, high sensitivity CRP, so basically osteoarthritis effects, reducing inflammation, those levels did decrease by a good amount. Interleukin-6, no effect, and then TNF alpha did have a positive effect. It got reduced. So again, reduced inflammation from the reduced levels of high sensitivity CRP and TNF alpha. This is probably where it gets its osteoarthritis benefits from, reducing of these two biomarkers. Now that first table I just went over was after 1 day. So now we're redoing the testing after 7 days of supplementation because again, remember the study lasted 7 days. So again, total testosterone, no change, right? There's 0.73, the p-value, so there's no change in total testosterone. However, we do see a positive effect on free testosterone. Now the p-value is 0.02. We see an increase from 11.83 to 15.18. So very, very good stuff there. It does increase free testosterone levels, so more bioavailable testosterone. Now, I told you before that total testosterone levels aren't a good indicator of optimized levels because there might be a high amount of sex hormone binding globulin and low amount of free testosterone. Now, boron in this case has reduced the amount of sex hormone binding globulin and it's increased the amount of free testosterone. That is great news here. We can see that boron can increase free testosterone levels. And another benefit here is we see that estradiol levels also decreased. They went from 42.33 to 25.81, and again the p-value is statistically significant. So that's good news for boron supplementation. We increase free testosterone levels and decrease estradiol levels, so that is a positive effect in terms of optimizing testosterone. Now, no changes in cortisol, luteinizing hormone, vitamin D. The changes in CRP are now not statistically significant. Even though the value is almost halved according to the p-value, it is not statistically significant because there is a high amount of variance. As we can see here, plus or minus 1,233. That's almost basically doubling the average amount. Same thing here, 795 was the average amount, but we have a standard deviation of 734. So although the average is showing that HSCRP halved, there is too much variance in the results. So again, the p-value is not significant. Interleukin-6 also still not significant. However, TNF alpha remains significant at a p-value of 0.05. So it did get reduced, which is good news. And also we see the ratio of free testosterone to testosterone increase, which is what we want to see. We want to see more free testosterone flowing around in the blood. And we also see an increase in free testosterone compared to estradiol, which is also a positive benefit. No changes in testosterone to sex hormone binding globulin or DHT compared to testosterone. Those ratios remained unchanged. So pretty good results from this study. However, very, very short, only 7 days, but we do see an effect on testosterone levels in as short as 7 days. But we want to make sure that this data can be extrapolated and used in the long term, because obviously optimizing your testosterone levels for 7 days is not something that is really beneficial in the long run. We want to kind of see if we can keep those levels increased throughout time. So another study here we're going to go over is plasma boron and the effects of boron supplementation in males. In this study, we have 19 males, which is a bigger study than the 2 that we saw previously. However, these are still very, very small studies. All of these studies are extremely small. 19 males is not enough really to kind of conclusively say that this is a beneficial supplement. However, it's better than nothing. It's better than what we have. It's not obviously compared to medications that have thousands and thousands of participants. However, for a supplement, 19 males, it's still decent enough. It's still something that we can see. As long as the data does show that it has a positive effect, we can kind of conclude that it may have these effects. So all the males had been weight training for at least 1 hour, so they're focusing on fitness in this study. The participants were also told to stop any vitamin and mineral supplements 3 weeks prior to beginning of the study to not skew any results. 10 males were given 2.5 milligrams of boron, while 9 males were given placebo for 7 weeks. So a much longer study, almost 2 months long. However, a very low dose of boron, only 2.5 milligrams in this study. So here we see a summary of the subject groups and what they ate. So a couple of things to note here in table 3. The 2 groups, the treatment and the placebo group, were slightly different. The group that took boron had more weight training experience by over 3 years, and they ate more carbohydrates and less fat than the control group. So that's something to keep in mind as we go through the study. Obviously, we want the two different groups, the experimental and the control group, to be very, very similar so that there's no difference. In this case, the results, we can kind of throw them out. They're not really going to tell us anything because they're not the same groups in each study. One group has an experience in weight training and their diet is more optimized compared to the control group where those levels are very, very different. Now, if anyone has weight trained before, you know for a fact that your biggest gains, your biggest, improvements in your fitness are in the first 3 months of weight training. That's kind of what it is because your body's kind of in shock. It's kind of all of a sudden you're putting on weight, you're putting on muscle, you're eating protein. Now that's where you get all your benefits. For someone that's really dedicated and following all the right protocols, it's not unlikely to increase your bench press by 45, 50, 60 pounds in that first 3 months of you weight training. That is not the case for someone that's been weight training for 3 years. I can pretty much promise you that it's almost impossible to increase your bench press or squat or deadlift by 60, 70 pounds after 3 years of weight training in a 3-month period. If you've been weight training for a long time, you're gonna have very, very small increases in your bench, your squat, your curls or whatever, because you're not at the peak of your fitness, but you're kind of getting close to it, and it requires more and more focus and dedication to get that level. So unfortunately, in this study, the groups were not similar. And it's going to be hard to kind of conclusively say if the boron supplementation worked or did not. Let's kind of go over the results and see what it says. So in this study, we see plasma boron levels. So this is a good thing because from here we can see if these people actually took the boron supplementation. If they took boron, then obviously their plasma boron levels in their blood should be increased. So as we look at it in the control group first, we see that pre-test, these were their boron levels, and post-test, these were their boron levels. So everyone except these two had a very, very low boron level. So we can pretty much guarantee that 7 out of the 9 participants in the control group did not supplement with boron or take an excess amount of boron through their food or their diet or whatever. However, in the boron group, it's basically the opposite. Only 2 people have boron plasma levels that are undetectable, very, very low. So 8 out of the 10, we can pretty much guarantee that they were supplementing with boron consistently for those 7 weeks, because if people are not taking their boron or they're forgetting 3 days a week or something like that, it's going to show up in this blood plasma results, and that'll obviously skew our results because we want to make sure that the control group is not taking boron or any excess boron through diet, and we want to make sure that the treatment group of boron is taking the exact amount of boron that we want. Basically, we can confirm who's taking boron and who's not taking boron from this blood test. However, we can't exactly say that it was 2.5 milligrams of boron every single day versus 0 milligrams of boron. That we can't really tell. However, it is pretty much good enough for us to show that boron levels did increase in the treatment group and did not change in the control group. So here are the results of this study. Now, anything that has to do with lean body mass, body fat, 1 rep max squat, 1 rep max bench press, we're going to ignore all those results because again, I told you before that the 2 groups were not similar. One group had been weight training for over 3 years on average, while the other group was much, much less. You're going to see better results in the control group. So since the 2 groups are not equal in that sense, the boron group has more experience in weight training, so they probably have a better protocol, they have better form, they have all these other things that are kind of more optimized compared to the control group. We're going to throw all that out. We don't care about these 4 results, even if it's showing significance or not significance. I don't necessarily care. I personally don't find any value in those numbers because again, the treatment groups were not the same. However, the thing we will look at is total testosterone and free testosterone. So we can see here that total testosterone increased for the boron group from 5.4 to 7.2. However, it also increased from the control group from 5.4 to 6.5. Free testosterone levels also increased, same thing with the control group. So total testosterone and free testosterone levels both increased in both groups, and we see no changes in total and free testosterone compared to the 2 groups. However, the change from the pre-test to post-test of total testosterone of both groups does have a p-value less than 0.05, so it is significant. However, we can't necessarily say that it's from boron supplementation because both groups did have a significant increase. And again, looking at this other table here, we're fairly confident that the control group did not cheat and take boron supplementation because we can see that their plasma levels were still very, very low compared to the boron group. Now let's look at this other study here, the effect of boron supplementation on its urinary excretion and selected cardiovascular risk factors in healthy male subjects. Study methods, again, only 8 participants, very, very low. It is a crossover study, which is a different kind of study from before. Usually those other ones before had a treatment group and a placebo group. However, a crossover study, because the participants are a very, very low amount, what they do is they give one group the boron, one group placebo. They give a kind of a little bit of a washout period, so maybe a week or 2 of not taking anything, and then they flop the groups. So now the group that was taking boron previously is now not going to take boron, and the boron group that was not taking boron, they are now going to take boron. So basically both groups are the treatment and control group at different times. The study lasted 4 weeks and the dose was 5 milligrams of boron twice a day. So basically 10 milligrams of boron total. So here we can see that the urinary excretion of boron is statistically significant, a very, very big jump from 1.64 to 10.16. So we can kind of conclude that boron levels were being increased because of the supplementation, because more boron was being excreted in the urine. That's kind of all this table is saying here. Now here are the results of the study. Unfortunately, they did not put it in a simple, figure or graph form. They kind of wrote it out in this paragraph, but I kind of summarize it by saying that testosterone increased from 7.4 to 19.4, but that was not significant. So probably due to chance, because the p-value is greater than 0.05, it's 0.06. And we see that estradiol increased from 51.9 to 73.9, and that was statistically significant. So testosterone levels did not change after the 4 weeks, but estradiol levels did change after 4 weeks. And if you remember the previous study, we saw that estradiol levels did not change after 7 days, but free testosterone levels did increase after 7 days. So I will go over this a little bit later when I go over dosing, but that's where the cycling phenomenon basically comes from. We see that after 7 days, free testosterone levels increase, estradiol decreases, but after 28 days, we see a flip. Testosterone does not change and estradiol increases. So people are assuming that 7 to 14 days is a good amount of time to take boron and then not take it for a little bit of time, because we don't want that increase in estrogen to happen. We want our testosterone levels to stabilize and not be creating an excess amount of estradiol. However, I will go over that in a little bit. Right now, we're going to go over foods containing boron. So here's a nice, easy, simple table of foods containing boron. So we see that high amounts of boron are found in avocado, apricots, currants, grapes, peach, and prunes. And on the right side here, we see a few more foods. We see avocado showing up again, peanut butter, peanuts, prune juice again, chocolate powder, red wine, and granola, and so on. So those are basically the main foods that have high amounts of boron if you were interested in increasing your boron levels through diet. Now let's go over boron dosage. So we see that this study, comparative effects of daily and weekly boron supplementation on plasma steroid hormones and pro-inflammatory cytokines, show that total testosterone decreased by 28% and estrogen decreased by 39%. We see that in this other study of participants taking 2.5 milligrams of boron after 7 weeks, they found that plasma boron concentrations were increased, but no difference in testosterone was found. So this tells us that 2.5 milligrams per day is probably too low of a dose for boron supplementation to make any meaningful difference in testosterone levels. So basically, from going over all the studies, I'm going to say that the optimal dose of boron is 10 milligrams per day, and you can split that into 2 5 milligram per day, twice a day doses, taking one in the morning and one at night. However, again, we saw from the studies that after 7 days, good levels of testosterone, but after 28 days, higher and higher levels of estradiol with not changes in testosterone. So basically, cycling is what's going to be important, and that's kind of what I'm going to go over next. We're going to go over cycling boron. So again, I have this figure here going over estradiol, sex hormone binding globulin, free testosterone, and kind of what's bound and unbound. This is a much better representation in my opinion. We can see free testosterone, testosterone bound to albumin, and testosterone bound to sex hormone binding globulin. Basically, the assumption is what happens in 7 days is the free testosterone levels increase, but after time, we see that more and more testosterone is converted into estradiol, so testosterone levels don't change or they decrease, and estradiol levels increase after 14, 21, 28 days of supplementation. So that's why we want to cycle boron, because we don't want that increase in sex hormone binding globulin happening, because as you can see here, it is inactive, and we want the free testosterone levels to increase, which happened after 7 days, because that one is the active one. So the best way to cycle with boron, the most common way, is people usually do 2 weeks on, 1 week off, or even 3 weeks on, 1 week off, and see how they feel. That's kind of a good way of starting and kind of, trying to see if your testosterone levels do change. However, I would always recommend blood testing your testosterone levels first and getting a blood test that's showing you free testosterone, total testosterone, albumin, and testosterone sex hormone binding globulin levels, because you want to get the full picture before making any changes in your hormone supplementations. Now, the last thing I want to go over is the different forms of boron. As we can see here, we have boron glycinate, boron citrate, and the boron complex, which the boron complex usually contains boron citrate, glycinate, and aspartate. However, the dose is usually lower when it comes to boron complex 3 or 6 milligrams. So pay attention to that when shopping around. You probably want to take 2 of the 6 milligrams or 3 of the 3 milligrams to get close to that optimal range of 10 milligrams per day for testosterone level production. Boron citrate comes in 10 milligrams. That's probably the most common form of boron that people take. Just anecdotally, people say that that one works the best and it doesn't have any drowsy effect or tiredness effect like boron glycinate. This has glycine in it, so it may have a calming effect, which is something you may not want if you're going to take it before a workout or during a day, something like that. So boron glycinate, if you're taking it at night, might be a better choice if it's going to help you with sleep. But in general, boron citrate is probably the easiest one to take, and it's again the most common. There are not any studies going over the differences in these boron formulations, so it's kind of a crapshoot into which one is going to be better than the other. It's probably going to be a preference. You can kind of test out each one and see which one works best for you. But they're all probably going to work very, very similar. It just matters on when you want to take it during the day. If you want to take it split into several doses, then maybe take the boron complex as it comes in a lower dose. If you want to just take one boron pill before your workout, then probably boron citrate. And if you want to take one boron before you go to sleep, then probably boron glycinate. That's kind of how I would go about choosing which boron formulation I want. But again, it's very important to cycle your testosterone boosters, whether it's KSM-66 or boron or Shilajit or Tongkat Ali, because they all pretty much have that effect of not having any changes in testosterone after several weeks, but increasing estradiol levels. So I have a video here that goes over cycling testosterone boosters that I want you to check out, and I'll see you all there. Thank you for watching.